They call me troublemaker, 'cause I'm finally saying no. I've been working hard and yet my pay is still so low. But when I spoke my mind, they said, troublemaker's gotta go. Troublemaker.
But we're here to celebrate the 30th anniversary of Friends of Medicare in the province of Alberta. We know, however, though, we can't let our guard down. The Alberta government, we've beaten them back before, we'll beat them back again, but they always have that plan for privatization in their back pocket.
Troublemaker, they call me troublemaker.
It's the plan that Don Mazankowski wrote back in 2000. They still have it on their desks today, and they're still using it today as well. So here we are inside the Mazankowski Heart Institute, a very controversial structure and facility, many years delayed in the making, and named after, I think, a very controversial figure in healthcare in Alberta and across the country. Mr. Mazankowski was emphatic that we can't afford our public system, it's costing us too much money, we need to break up the monopoly of our public system. His ideas and his report are still what we believe to be the blueprint for the Conservatives' privatization plans here in Alberta. You can see some of the iconography in the lobby here speaks volumes about what the Alberta government's vision of healthcare really is. Well, here's some of the remarkable artwork in the Mazankowski Heart Institute. This is a larger-than-life statue of Bill Comrie, the brick warehouse owner who I guess donated to the Mazankowski Heart Institute. And you know, it's interesting because in the Don Mazankowski's report, he talks about how we need to tighten our belts and in regards to public spending, in regards to health care, but I don't suppose Mr. Comrie ever had to tighten his belt during the course of his business career. And here he is, standing like a Roman senator in this amazing public building that was built with public dollars. I think he has room in his hand for our pamphlet, so that certainly is a good idea. We will always have a push for private health care as long as there's individuals who seek to profit unfairly from others, from the health system. This is something that Friends of Medicare has a problem with here in this province. You have a business here that prescribes drugs and dispenses drugs all in the same building with a connecting hallway in between, run by the same company. Now, case in point, I mean, here is the drugstore on this side, and here's the doctor's office on that side. It's a smooth interface between the prescriptions that go on here and the filling of the prescription over there. So it's definitely a problem. It's something we're fighting against by building a stronger public system. The walk-in clinics meet a need based on a gap in the services that are provided through our public health system. Hundreds of thousands of people in this province do not have a family doctor. They need to come in here when there's an emergency, but is that looking after their whole health needs? I don't think so. We know that the public health system is more efficient, it's more equitable, and it delivers better health outcomes. We know that Albertans want their public health care improved, not dismantled. The government hasn't learned that lesson yet, or they just won't listen to it. But we're there to make sure they have to listen to it because we organize people in this province and they push back. Albertans know better than any province in this country the value of their public health system. Just imagine if you have to pay for a procedure when yourself or your loved one is sick. Just imagine if you have to pay private health insurance rates like they do in the United States. Just imagine if you don't have that extra coverage or that extra money. We've managed to avoid all of those things because of the strong structure of a single-payer health insurance system in the province of Alberta. We're not going to give that up. No matter what pressure the government puts on us, no matter what impositions the private health insurance system tries to put on us, or private HMOs who want to run private hospitals for the elite few. It's not going to happen in this province. It's not going to happen as long as Friends of Medicare is there to fight together to build a stronger future for all Albertans.
Keep on singing loudly. Keep on